Dear Chairman, dear colleagues, let me present you my PhD topic, which is the prognostic value of MMP7 in urothelial carcinoma. My name is András Kubik. I'm working at the Department of Urology, and I'm a first-year PhD student. And my vision would be to empower patients through excellence in the care they receive from our department, and my mission is to provide high-quality care for people with urinary bladder cancer. As a trained urologist, I always was curious about patients' prognosis and how to predict the best treatment for them and how to choose it. And that's why we choose the next topics. From the first, it's investigating MMP7 as a prognostic biomarker in urothelial carcinoma. And the second one, investigate the prognostic factors and treatment modalities in small cell bladder cancer, which is a very rare urinary cancer disease. So it's a combined registry and a meta-analysis, and you have to know about urinary bladder cancer, which is the second most common urological malignancy with globally more than 200 deaths annually. Most of the cases will be presented with non-muscle invasive bladder cancer, but in about 20% there are muscle invasive bladder cancer, and the gold standard treatment for them is radical cystectomy, lymphadenectomy, and perioperative chemotherapy. The half of the patients will benefit from this radical procedure, but the other half will rapidly progress and die within 5 years. So there is a huge need for biomarkers to detect early metastasis and predict patients' prognosis. So my aim is to assess the prognostic role of MMP7 in urothelial carcinoma patients. A few words about matrix metalloproteinases. You have to know about everything, but they are linked to cellular processes relevant to tumor growth and progression, and they support extracellular matrix degradation, angiogenesis, and apoptosis. And it has been shown in the literature that the elevated MMP7 levels are associated with lymph node metastasis, and its prognostic value have been validated in different patient cohorts. So we hypothesize that MMP serum and plasma levels are prognostic indicators of urothelial cancer patients' outcome. We drafted the clinical question, can MMP serum and plasma levels predict disease progression in urothelial carcinoma patients? We used the PICO framework with population for urothelial cancer patients treated with surgery or systemic therapy. Preoperative high and low levels of MMP7 levels were measured, and the outcome as overall survival and cancer-specific survival were measured. As it's a combined registry, you have to know my two cohorts. The first registry is with 87 muscle-invasive bladder cancer patients. The second one is with 68 muscle-invasive bladder cancer patients. And we hypothesize that muscle-invasive bladder cancer patients with lymph node positive disease and high MMP7 levels have poorer prognosis. So we drafted the next question. Do patients with elevated MMP7 levels have worse overall survival rates? We use the same methodology with muscle-invasive bladder cancer patients, preoperatively measured high and low MMP7 levels with predefined cutoff levels, and overall survival and cancer-specific survival was measured. And the clinical implication is that may MMP helps find optimal treatment for high-risk bladder cancer patients. We performed a systematic search with more than 400 articles, and we made the full text selection as well, and data extraction is in progress. Let's move on my second topic, which is to investigate prognostic factors and treatment modalities in small cell bladder cancer patients. Urothelial carcinoma, based on histology, will be diagnosed in more than 90% of the cases, but less 1% of the cases are neuroendocrine carcinoma, in which small cell neuroendocrine carcinoma is the most common, with early metastatic spread and poor prognosis. And my aim would be to find the optimal treatment for neuroendocrine carcinoma patients. And as we use the EO guidelines, which is the European Association of Urology, and there is no gold standard treatment for this kind of disease, we can use two staging methods depending on the metastatic spread of the disease, and due to the rarity of these small cell bladder cancer patients, there is no optimal local treatment of pelvic limited disease, and it remains controversial. There are different treatment modalities in which we can choose depending on the radicality of the procedures and the perioperative oncological treatment. Looking at the data, there are no evidence of necessity for radical procedure in case of available perioperative multimodal treatment for non-metastatic patients. So we drafted the next question: what is the optimal treatment for patients with non-metastatic small cell bladder cancer? We hypothesized that radical cystectomy did not influence overall survival in the patients with non-metastatic disease. So we used the PICO framework, population for small cell bladder cancer patients, and intervention and comparator would be radical cystectomy and perioperative systemic therapy, and the comparative bladder preserving techniques and concurrent chemoradiotherapy, and overall survival will be measured. We performed a preliminary research with more than 600 articles. There is no Prospero registration. And to summarize my research is we're planning submission in May and in July, and I'm very thankful for your attention. And let me close my presentation with the words of Victor Kiem, which is, even if you fall on your face, you are still moving forward. So thank you very much for your...
My question is about the first project, and I mean, that is not straightforward. I'm just curious then. I mean, the level of some enzymes like MMPs, I mean, change, that probably there is something behind. So that is not really the cause, but that's a kind of consequence. So do we have any kind of clue on this, that genetic background or other backgrounds in these patients which might be different from the non-MMP7 elevated patients? Not yet.
Yeah, in patients with lymph node metastasis, these levels are elevated. So we could compare these groups. And in other disease, MMP or MMP, there are a lot of MMPs, but MMP7 can be elevated as well. But in metastatic patients, it can be elevated much more. And it could be very useful and very important for us to detect early metastasis in that disease. Then if we know them, that there are some, then we can choose the chemotherapy earlier than in normal, and that would be a very useful tool for in the daily practice.
Congratulations on your presentations. I have a question regarding your first project. You said you're looking at MMP before surgery and after surgery, but...
before surgery, if it's elevated, so we check before surgery the high and the low levels of MMP7 regarding the metastatic spread and then the accession of the disease.
So you are only looking at patients that receive radical cystectomy and not trimodal therapy, which is bladder preserving?
Yeah, it's the second topic when we want to exclude or we want to compare patients with the radical procedures and with bladder sparing techniques. In the first project, we are looking on muscle invasive bladder cancer or urothelial cancer patients with surgery or with systematic therapy. So there is a big cohort with these articles, and these patients have muscle invasive or urothelial cancer.
I see some patients do receive radiotherapy for muscle invasive urothelial cancer. That's why I was asking. So even in Hungary.
Yeah, it can be.